And actually, that makes total sense.
Yeah.
Because I know me.
And
So that's our life mission. That's the McShin's mission.
So you don't have to understand my boundaries to respect them.
Well, no, I'm the president and co-founder of McShin, a person in long-term recovery from substance use disorders.
How do you go about fixing the damage in the trust between the family after you get out?
Okay, I gotta work on that.
Celebrating my 6 months. Didn't have a cake.
Yeah.
Gosh, showed up.
Hello, everybody, and thank you for joining us today on this live edition of Get in the Herd. I am Raymond Ruybe, your host, and I'm joined today by Chris Shaffer, who is the McShin Foundation's medication monitor. Chris, you want to introduce yourself to our lovely audience?
Yeah, my name is Chris Shaffer. Like I said, I'm the medication coordinator here at McShin. Clean date's 2/5/21, so I just celebrated 2 years clean.
All right, cool. Yeah, well, I'm right behind you. I'm going to hit that amazing benchmark later on this month. So looking forward to that.
Yeah, from my first year to my second year, I carried my 1 year medallion in my fifth pocket, right? You know, in the little pocket of my jeans, and now I have my 1 year and 2 year medallions that I keep in my pocket at all times.
All right, cool.
The only time they leave that pocket is when I wash my jeans.
Well, look at you, money bags. All right, cool. So today we're going to be talking about a number of different things, but we're going to start out talking about medically assisted treatment, which I think is something that you deal with from time to time as our medication coordinator here at McShin. So I guess the first question I would ask is, in your experience, in your recovery, how important is medically assisted treatment?
Well, in my recovery, I used Vivitrol, for about 6 months after leaving incarceration during that period of transition from, incarceration to complete freedom. And I used it for my own safety, just in case, things got overwhelming, because that's what my past has told me, that after so long of being free, I started to act up. So I figured with the last use that I had ended up putting me in a coma and put me in the hospital. And I was like, I don't want to go through that again. So I used it to prevent, basically essentially death or, a serious issue. So if I did make another mistake and end up going back out and using, I had a chance to come back and get back to recovery and maybe not have it be my final, use. And like I said, there's, with the different forms of MAT that are out there, I think, each one has its various perks and, disadvantages. But I think whatever works for whatever person is, kind of the idea of what we want to do here.
Cool. So yeah, I want to capitalize on what you just said there. You said each one has their perks and their disadvantages. What do you think the primary disadvantage is? I want to get the negative out of the way before we go into the positive. But the primary disadvantage of using a medically assisted treatment, in your opinion?
Well, I think it really depends on the type of MAT that you use, because some of them, obviously have a detox period after you come off of them as well. And if they're not done properly, then, you end up going through the same, you just prolong the experience of the detox. So eventually you just put it off to be dealt with later. So that would be the major disadvantage. I think the other thing is that when you have to go to the doctor every week to pick up a prescription or go to the pharmacy every week, you're essentially still going after that same chase, so that, the behavior is still the same. It's just you're going to a different person.
Yeah.
So I think that's the primary disadvantage to any of the MATs out there.
So I guess which MAT are you talking about in particular? Because I know that Vivitrol doesn't have a detox, does it?
No, it does not. Obviously methadone would be one of the ones that would have a serious detox period if you stay on it for a prolonged period of time. And then, Suboxone. So, the buprenorphine.
Yeah, and so let's talk about the advantages then of medically assisted treatment, other than I guess getting the stuff out of your system. To me, the advantage right off the bat, right? If somebody's got an opioid addiction, and let's say they're using fentanyl, for instance, fentanyl will kill you in huge doses, or even in small doses. But if you get on a medically assisted treatment, it helps you with those. It helps you with the withdrawal from the fentanyl, and also can kind of keep you at a baseline moving forward.
Yeah, I think the idea of used properly, medically assisted treatment is like a bridge between using to complete sobriety, to kind of make that transition a little bit easier.
Yeah.
Done properly, it will lessen the the detox period. There'll still be some ill feelings when you come off of like a detox, but at any time, but it lessens the severity of those. So when you come off, it's a little bit easier to deal with, and hopefully it's something that makes you're at a stronger point in your life where it's easier to come off of that stuff.
Yeah. Let's talk about cannabis for a second, or cannabinoids, because I know a lot of people in the Richmond area, now that it's become legal and medically prescribed, use different cannabis products to help with anxiety, depression, and other withdrawal symptoms. We don't allow cannabis as medically assisted treatment here at the McShin Foundation, but based on your experience, what have you seen out there in the recovery community?
I mean, I think that there's, there's advantages and disadvantages to anything. I think if it would be the lesser of two evils. I mean, if somebody has to use something, I think that cannabis in particular, it would, if you're using it for, say, anxiety, I think that would be the safer option versus like going on Xanax or something, or benzo, because obviously the detox from those can kill you if you stay on them too long. Whereas marijuana is just, you just kind of don't want to get up the next day because you haven't had it, so it's the lesser of two evils. And I mean, for me, if it works, it works.
Yeah.
I don't, just because it's not my pathway and because I don't use it doesn't mean I don't think it doesn't work for the next person.
Yeah, I'm very much of the same mind. It's not something that would work for me in my recovery now because I'm almost 2 years, and why would I want to get on anything at this point? But it's nice to know that, if I had to in the future, right, living on my own, and being somebody who suffers from epilepsy, for instance, if there's a new drug that comes on the market, and I'm prescribed it, it's nice to know that, I get on that medication to treat my epilepsy. I get on something that might treat my anxiety and depression, but it's not going to ruin my recovery, right? Not if I don't allow it to. If I'm being prescribed something by a doctor, if I'm monitoring it very carefully, if I'm sharing the experience with my sponsor and my sponsorship family, I feel like I'm still doing everything right.
Well, the other thing I think about when I think about cannabis is like the amount of side effects that cannabis has. Like you get the munchies when you smoke a little bit too much cannabis. But
got that problem now
when
without
you start you start taking medications. You get a medication to treat like a headache, and all of a sudden you got liver problems and heart palpitations and skin disorders and all these things that come along with these weird medications. And I think the amount of side effects that cannabis has is a lot less than a lot of the pharmaceuticals that are out there.
Sure.
One big thing with cannabis too is it's a lot safer too. There really is no chance of overdose with cannabis. You're not going to die from an overdose.
Yeah, I mean, overdosing on methamphetamine or cannabis, those things are rare, but it does cause some cognitive impairment.
A methamphetamine overdose could kill you though.
Oh no,
You
without
have
a
a heart
doubt.
attack,
Yeah,
yeah,
heart attack
yeah.
or stroke.
I feel like with cannabis, I looked it up and it said something like you would have to consume 1 pound of cannabis within 1 day or something like that, which is you can't even put that into your body.
It would be impossible unless you turn around and took like the cannabis and put it into like an extract and drank it or
and
something.
even then, it's like
you still probably wouldn't be able to get through it all in a
now
day.
overdosing on any other stuff like benzos or anything else that can be used for MAT definitely has to be monitored, and there's more risk.
Yeah.
I guess,
Well, to our audience though, before anybody in the audience thinks, "Oh, challenge accepted. Let me try to do this." It's really not something that we're advocating for here at all. We're discussing different options rather than promoting or encouraging anything. We just want to have the conversation.
Yeah,
for sure.
I think the other thing too that doesn't get really talked about as much anymore is these people that were on different forms of MAT. They try to find them on the streets because of not wanting to go to the doctor, not wanting to admit that they're using, and so they'll go buy particularly like a benzo, off the street, and they find that a lot of these are becoming like dark web drugs or designer drugs that have a much more severe reaction when you come off of them. One in particular that we've seen a lot around here is called bromazolam. And it does mimic like the feelings from Xanax, but it's at a higher level. So it's obviously the detox period from that is much more severe.
Yeah.
that's what had me at Tucker's hallucinating.
Yeah, I've seen
that
it in a
detox
couple.
was horrible. That was like, I tell some people that like that changed me really.
Did it?
Like I had a spiritual experience. So I guess that was a positive. But yeah, I mean it was scary.
Yeah.
Some of these designer drugs that are out there, because they're the issue is that you have a lot of these I don't want to say companies because they're not companies, but they're like cartels essentially that are making these drugs. These guys aren't really pharmacists. They're just like in their sheds in their backyard mixing up chemicals, and then you get what you get.
Yeah.
So you might be able to take one pill one day, and the next day you take one, it's 4 times stronger because they haven't mixed it properly or pressed it properly. And before you know it, you think you're in control, and you end up overdosing.
Well, and I've seen some of that firsthand too. Sometimes I've seen being in the academic world, right? I used to be a professor there, a lecturer, and I also spend about 9 years of my own personal time in school. And I'd see people who would get Adderall prescriptions, and then suddenly the doctor's like, "Yeah, you can't take it anymore. We think you have a problem." And rather than say, "Okay, let me work on this and not take Adderall anymore," they start shopping around with friends or in the academic community. How do I get this drug? Next thing you know, they're taking something that they hadn't expected, and it causes an even worse adverse effect.
Well, I know one of the things I was watching today this morning. It's one of the things I do every morning. I wake up right at 7:00 every morning, so that's usually what's coming on. And I was watching it, and they were warning. I guess I don't know if it was the FDA or the government or some government agency was warning people that when they go to Mexico to be careful of the drugs they buy down there, even the ones that are prescribed by doctors, because they said like 60% of the Adderall that's down there is actually methamphetamine just pressed into a pill.
Oh.
So now they're now these cartels are actually starting to get into like the actual like medication part of it.
Right.
And so they're increasing their network by doing that. And I think because of the fact that Adderall is on a nationwide shortage at this point, so it's really hard to kind of really keep a constant prescription. People are starting to use that route, and they're buying methamphetamine now. They're not buying amphetamines anymore. So they're getting something that's a lot more addictive than what they're expecting, and that's coming from the doctors now.
Yeah, it's when doctor shopping becomes an international experience. That's when I think that you have to step back and say, well, maybe I do have a problem. Yeah.
You would think.
Yeah.
You would think.
Yeah, without a doubt. So, so other than the Vivitrol, what are your other experiences with medically assisted treatment, Chris?
That's the only one that I've ever used. So my personal experience revolves around Vivitrol personally. Like I said, we have various participants here that use different forms of their MAT, and I think that done properly, it works great. As long as they're doing it as the doctor prescribes, they're doing what's asked of them, and they continue to maintain a healthy lifestyle. Then I think what the hell, go for it.
So I suppose in your position, then you have the firsthand opportunity of seeing folks when they first come in. Usually nobody's at their best when they come into recovery for the first time, or even especially the second or third time.
It was my third.
Yeah, all right. So I'm still on my first. I don't want to have to jump a shark and do that all over again for sure. But you get to see people on medically assisted treatment turn their life around in a lot of situations.
Yeah, I mean, I know like we had a gentleman that just came through, currently still here, and when he got here, it looked like he was just beat up. He looked like he was essentially a walking zombie at that point. There was life in his eyes, and you're talking 7 days later, he's smiling, he's joking, he's playing. I mean, you can literally watch the light switch on in a week, pretty much. And one of the things I try to explain when people come through and, they're all in those kind of things, I said, biggest thing is try to force food down. You got to eat, you got to get your nutrients back, you got to drink water, try to flush that other stuff out of your body as fast as possible.
Sure.
And I think that does lessen the detox when you can purge it all out as fast as possible. And like I said, it took him about 7 days, and now he's in a really good state.
Good.
So I get to see it. I get to see people, they pack their meds in the med room with me. And so each week I get to see pretty much every participant that's in our program between that and the urine screens. And so, yeah, you definitely can see a transition in a pretty quick period of time where that life starts to come back to them.
Yeah.
Skin tone changes, smiles come back to their faces, things like that.
Yeah. I get to see that from a completely different angle because I do feelings check-in every morning with all of our participants. And, from like day 1 to day 7, usually people start to understand like, oh, you know what? Just being able to let go and not have to worry about stuff that I worried about, 2 weeks ago, not having to worry about like, where am I going to score or cop my next, hit, and just relax and sort of surrender almost to themselves and to the situation. That can have an amazing effect also.
Yeah, I know. I remember when I used to, because I went through that same intensive program when I was released from incarceration. And I know like when I did it, the thing that was nice for me was I didn't have to worry about the past because the past was already done. I didn't have to think about the future because everything was kind of provided for me. I just had to show up and exist. And it was a nice transition from being, going from incarcerated to like slowly integrating back to society. And it was kind of what I needed because every time I'd come back and went right to running, trying to, get a job, find transportation, get the phone, get the, the friends back, that kind of thing. And it was nice to just not have to do that. And so every time they'd ask me like how I felt in the mornings, I always be like, I'm great. Because, like, I really am. I don't have to worry about anything. Like, everything's provided for me at this point, so I can really focus on just what I need to get through, these 28 days. Really identify the goals that I have for the, after the 28 days. I can really spend the time to focus on what my defects were and the thing, my thinking processes and things like that. So when that 28 days came and I was, now I'm out on my own, now I have a list of what I need to complete, kind of thing. And that's what that was the beautiful thing about my 28 days. So I did come this last time with about 10 months of clean time because of the incarceration. So when I did my intensive program, I came in with, the fat belly. I came in with the smile on my face. I came in, I was just in jail. Like it didn't matter where I was at, I was happy.
Yeah.
And it doesn't last all the time. Like not every day is a great day when you're going through an intensive program. You're surrounded by the same people all the time doing the exact same routine. And in the moment I didn't really like it, but now looking back on it, it was like what really changed my life and made a difference for me.
Yeah, that's great. I think you hit it right on the head, right? You hit the nail right on the head. You said, you get to come in, you get to start to think about things and plan goals and sort of just focus on yourself. And in any situation where you get to do that in a safe and responsible way, right? Even if it's using a medically assisted treatment, an MAT, that's a huge burden that you get to lift off your shoulders.
Yeah.
It's like you're not just running anymore. You're working towards something responsibly.
Yeah, like I've always been somebody who I like to have my thought process challenged. Because of course I'm, as an addict, I think that I'm right all the time. I don't think anybody can tell me anything. And like now I'm starting to get sober, for some time now, I've noticed that I'm not always right. And it's not always easy to admit that. But like I was having a conversation with somebody this morning. I was listening to a TED Talks, a podcast in my office. And one of the questions that was posed on the podcast was, what do you want your legacy to be? And so, of course, I was like, ooh, that's good. Like, that's loaded. So I started asking a bunch of people the exact same thing to see what they're, and the person responded to me. They said, she said, I think that my, my legacy is far past. I can't create a legacy anymore. And I was like, all right, how about this? How about we start posing questions each morning that challenge our thought processes? Just something that we know that like the other person might not agree with, and just open up dialogue.
Yeah.
And then figure out what the next step is. So now I'm at that point where like my growth is like more internal, and I recognize the need for help from outside for that growth to happen. And I think that like you never know where that source of growth will come from. There's times where I'll like lay in bed, I'll be watching like a TV program, and somebody will say something. I'm like, ooh, and it just makes me think. Where I, 2 years ago before I started this process, I would have just skimmed right over what they said. I would have ignored it. And now it's like, you never know where that inspiration will come from like the next change.
Yeah.
Like,
That's great. I don't want to minimize your experience either, because even though you were incarcerated, I'm sure you probably still had access to narcotics.
Oh, absolutely. Well, yes, we did. I mean, they're definitely there. I think anytime you lock up a population of people that are using, just because they're incarcerated doesn't mean they're going to stop using.
Right.
Like they didn't choose to go there, so they're going to take their old sick selves with them into the jail. And that means, of course, that obviously they're going to bring what they can. And there was various methods for them to obviously get into jails. Like people leave every day, they come every day. Like, there's always going to be a flow. But I think the last time that I was there, I got with a guy who actually went to the healing place. He ended up becoming my roommate. Excuse me. And we would sit down each night. We found a basic text while we were there in the library. And we would sit down each night after we got off work, and we would pull that book out, and we'd read something from it, and then we just have open dialogue discussions about whatever we read.
Yeah.
Which, from what I understand, is kind of how the old school
Yeah.
the NA program worked before there was a step working guide. That was how you did it. You read the book and you answered the questions and, created dialogue, and that's kind of how you worked your steps back then.
One addict helping another.
Yeah. And that was something that made a difference for me, and that's where, I started to recognize the change, because he'd completed the 12 steps. So he had this way of just like saying one thing that would just like, piss me off in the moment, but then it'd make me think, and I'd sit back and think about it. And I'm like, damn, he's like, he's right. He just had a way of challenging me, and that's kind of where my process started, was with this guy. And of course, when I got out, that's when I came here. They were asking me about where I wanted to go, and I said, honestly, I want to do the intensive program if I can. I don't have the funding for it. We can figure something out. That'd be great. And through God's work and the people that are here, I was able to go through that intensive program, and it did something for me.
Good. I'm glad. What was the moment where you thought? What was that sort of like kicked on moment where instead of thinking, hey, I want to hit the F it button and go out and do something stupid, or I want to hit that F it button go do something for myself or go to a meeting instead. When do you think that happened for you?
I think, I can tell you, it was probably the day that I was released. Was when I finally made that real, I realized that the determination to do something different was there. Because I was released at 6 in the morning. Right. My ride didn't show up until about 7:30. So
Wow.
I'm sitting at the jail on this little park bench, sitting outside there. Of course, all I want is a cigarette and I want this. Nobody's coming. I'm just there by myself. And the person picked me up. We ate breakfast and all that. And they were like, well, what do you want to go do? I said, you know what? It's Sunday morning. I said, I know they got that spiritual service up there. I want to go see everybody. And so my first thought was not to go out and go shopping, not to go, do this, do that. I want to go see the people that, that helped me get to, turning myself in, before for the first time. I said, I want to go back to these positive people that helped me in my life.
Yeah.
And I got back and I hit the ground running.
That's great.
I haven't stopped since. All the same people that were in my network before I was incarcerated that were positive are still in my network today. One of them actually is one of the ones who gave me that medallion that's sitting in my pocket, that I carry every day. And so, it was those people that made the difference for me. And I knew when I came back up here and I saw like the love that, was shown to me as soon as I showed back up, I was like, this is where I know I need to be. And this is the life I want to, I want.
That's great. That's great. So, wow, I've got nothing. I can't follow that. That was such an inspiring story. I don't even know what to say.
Well, I can tell you. So when I first got here, right? There's all the paperwork that we got to do, and it can be overwhelming doing all that paperwork. It's like literally a full day's worth of like bouncing from this room to this room to this room.
Yeah.
And I remember this was at the time when our women's program director was just a PRS at the time before she received her promotion. And she was the one who actually did my rec cap. And I remember just like answering the questions, and I'm like, let's get through this. And we were joking and playing. As you know, I'm a joker and I like to laugh a lot.
Yeah.
And so I'm, cracking jokes and we're playing. And there was one question I remember she asked, and she was like, what do you want out of your recovery? I don't know if it's under the goals or it was something along those lines. What do you expect to get out of recovery? And my first question was, answer was, I want to be happy.
Yeah.
Because I didn't really know what I've been using since I was like 12 years old. I don't know what happiness is without using. And she said, asked me like, what does it take? And I was like, I wish I knew.
Yeah.
I wish I knew the answer to that, because if I knew the answer, I wouldn't be here.
Yeah.
I'm here looking for help. Like I need y'all to tell me how to, freaking live my life. I wasn't living it right because I keep going right back to the same places that I've always gone, back to incarceration, death, institutions, things like that. Those things we always talk about. I've hit them all.
Yeah. I don't think there's anything funny about that at all. It's about as real as it gets.
There's nothing funny about it. I mean, I can tell you, the last time that, on February 2nd of 2021, when I used, I ended up in a coma for a couple of days. And, doctors eventually reached out to my sister. My sister obviously was my only living relative anymore. And, of course, she had to make medical decisions. And, the doctors told her that it was about a 5% chance that I'd make it through that process. I was, essentially brain dead, no activity, nothing like that. Luckily, my sister decided to hold off for a little while to doing it, making any major decisions. And a couple of days later, I just woke up out of it, with no explanation. Doctors still couldn't really tell me anything. And they said, surprisingly, the only thing I had was a little bit of a bad heart, obviously, because, from an overdose, you put the strain on the heart. He said, you might want to see a specialist just to make sure there's no serious trouble there. And then, of course, to check my liver out, because I contracted Hep C during my using days. And both of those issues have been treated now. I've got, to the point where I have private insurance now, so I was able to treat both of those issues. So my Hep C is cured, and I went to see the doctor the other day, did an EKG and a cholesterol check and that kind of stuff, and everything came back all right. So, no lasting damage from the decisions I made. But when I came back here, after I left the hospital on the 5th, I came back. I came back down here, and I was moved into a house that was pretty close to the center that we have here, and I was told I had to walk every day. I had to be over here every day, which is fine. I was willing to do whatever. I gave my phone up, I gave my car keys up, I gave it all up. I was like, whatever y'all need to tell me to do, I'm gonna do. I gave it all up that night, and I remember coming down the stairs that first morning, and I got down to the couch and I sat down. I was so tired, like I was so beat up that I fell back asleep. I literally just woken up from like a 12-hour sleep, and I went down and I fell right back asleep on the couch. And I remember waking up, and the guys that were in the house had made me a fruit. They were all going to the gym, and they working out and all that kind of thing. And they made me a fruit smoothie. And I remember waking up at like 11 o'clock. This is like 6 in the morning. They made it. I went waking up at 11. There's warm smoothies on the thing, and it's about the only thing I could get down, and stomach. But I fought that thing down. And but like having to learn how to like walk again, where I could walk steadily, where my legs actually were under me. Having to learn how to talk again. It took me, I'd say a couple words, and I'd have to rethink like the whole sentence to like recalibrate my thought process. It didn't just happen like instantly like it does now, where I might just kind of vomit at the mouth. It was something that it was a real process to get me to learn how to, talk again, get back to normal.
Yeah.
And that's what really scared me the most. Like, I always said that death is like an easy way out.
Yeah.
When you die, it's just, you're done. You know what I mean? But having to live without being able to fully function in life was something that scared me. And that's really one of those like defining moments in my life, was where I woke up and I was like, all right, this is what we're not going to do again.
Yeah.
So
That's suddenly being faced with consequences and having it like look you right dead in the eye and decide, oh, I don't want it to get any worse than this.
absolutely. Well, the thing for me was like, when my mom and dad were alive, they always bailed me out of all my consequences. Anytime I got in trouble, they paid for the lawyer, they paid for the help. So I didn't never really faced real consequences.
Yeah.
And this one happened after my mom and dad had passed away, so now it's all on me. I end up in jail on my own. I end up having to figure out what I was going to do when I get home on my own. Like all this stuff I have to figure out on my own now. So it was like a forced, learning experience that happened instantly.
Yeah.
There was no transition. It was just like, guess what? You're on your own. Figure it out. And
Yeah.
that was tough. It's still tough. Not having like when I make a bad decision, I go spend too much money, not having that like bailout plan. Like, hey, Ma, can I borrow $100? I need to pay rent this week.
Right. Yeah.
You know what I mean? Or I make that decision to like not pay one cell phone bill so that I can keep the lights on at the house. Like, those are, those things still present themselves, and not having that, like, that support is sometimes still tough. But it's also forced me into like learning how to grow up a lot faster, which is really beneficial, because I'm almost 40 years old. Like, I should know how to manage my own bank account. I should know how to manage a checkbook at 40, but I'm learning it as I go now.
Yeah. There's nothing wrong with starting late. I know I lost both my parents when I was in my mid-20s, and there's something really really fundamental about waking up one morning and realizing that you're sort of flying without a net. Like there is no backup plan at that point moving forward, where you're just like, oh, I could just call somebody else and ask them to help me out, because you don't have it anymore, and you got to really start doing stuff for yourself.
Well, I think the thing that it really did was because I remember when I was doing my 2-year celebration, I said, when I lost my parents, that was one of the hardest things I'd ever gone through, and I felt like I didn't have a family anymore.
Yeah.
And then I'm in my celebration, I'm looking around the room, and there's 150 people in the room that are there to celebrate me.
Mm-hmm.
And I thought, like, I do have a family.
Yeah.
I do. Like, I have people today that I've culminated relationships with, positive relationships, that if I call and say, hey, I need some help, I need to, this, or I need that, I don't know what to do, they're willing to go out of their way to help me.
Yeah.
So I do have that support now, but it not having the support when I was, left incarceration was what forced me to start building these relationships that are actually meaningful and positive relationships.
Yeah.
And those have made the difference for me still to this day. I've been out of jail almost 18 months. I still don't have a license.
Yeah.
So like I have to rely on people for rides, when I need to go places. Like those are things that like people are willing to help me with. Hopefully that'll end in like the next month. I'm really close to getting my license back. I just got to jump through some more hoops that the government wants.
Yeah.
Once I get these taxes filed, I'll be able to pay the last fine that I have. And then I can start the process of going to the DMV and taking the test and stuff like that again. And hopefully within the next month or so, between filing and the end of the process, I should be pretty much done.
Cool. Yeah, I mean, just to get back to something you said earlier too about having a support network now. You have that support network because you did the work.
Oh,
you
yeah,
show
absolutely.
up, you do the work. You're there for others. It's not just something that magically happens overnight.
No, I mean, I definitely did. I mean, I had to sacrifice a lot of self for other people to show them that I was worth being in their lives.
Yeah.
Because I've proven for time and time again that I'm not one of those people. That was in the past, that I was not one of those people that you want in your life. I was somebody that would come into your life. I would take, I would use, I would do whatever I needed. And when the well dries up, I'm on to the next well because I'm thirsty. Still.
Right. Yeah.
So it was something that like I had to like basically earn trust back. I had to earn that I'm a responsible person back. The first time you ask somebody for like $100, like, hey, I need some help with this. They're probably going to be hesitant about giving you $100, especially because we're addicts. It's just that freaks a lot of addicts out. But once you start doing it and you start paying that money back, you earn that trust back. Then it's just like, okay, you need how much? All right, here you go. I'm going to send it to you.
Yeah.
And then they know that they're going to get it back. Like I'm trusted today, which is something that I haven't been for a long period of my life.
I don't think anybody's ever asked me for money yet. I don't know what that says about me, but no, I'm kind of happy about that too.
Yeah.
So it's all good wash, right?
Yeah.
Well,
Now
actually,
I was waiting for it. That was prompting you there, Art.
Since you brought it up.
Yeah, since you brought it up, hey, you got 200. Hey, so Chris, we're about to wind down. Is there anything you'd like to say? Any closing comments or words of wisdom about anything? We don't even have to stay on topic anymore. Just go ahead.
Yeah, I think you know the process that I've gone through is beautiful, right? You know, I don't know where I would be without this process. You know, 2 years ago, again, like I said, you know, before I started this, I was not somebody you wanted in your life. And you know, going back kind of to that legacy question, what is your legacy? Like since I heard that this morning when I was listening to it, I thought about it, and you know, and some people think like I want to be successful or I want to be famous or I want to be this. Like all I want to do is be a damn good person.
Mm-hmm.
You know, I want to be somebody that makes people laugh, can bring them out of bad moods. You know, and I think I think I am that person today. You know, but what I want to do is I want to maintain that. You know, I don't want to go backwards and slide away from that. I want to be, you know, known as that person, that consistent person in people's lives. Like, you know, they always say the best ability is availability.
Mm-hmm.
You know, so if I, you know, just by making myself available, I'm doing the best I can.
Yeah.
So I'm just going to keep showing up and keep, you know, coming back, and you know, the rest will hopefully work itself out.
All right. Well, thank you so much for joining me today, Chris. It's always a pleasure. I work right down the hall from you. And I want to thank everybody in our audience for joining us today for this live podcast of Get in the Herd.
Thank you for having me.